does not need to be a part of your life. Knees, shoulder, hips, ankles, elbow, or spine pain, treated without surgery. That's right, no surgery. Dr. William Hunter at the Medical Aesthetics Regenerative Center uses your own body cells to successfully treat people's joint pain without surgery. So, no side effects, no downtime for recovery.
Let's help you get back to your regular life, faster and stronger.
My name is William D. Hunter. I'm at Neuroscience Spine Center in Gastonia, North Carolina. The prevalence of spine problems are massive in the United States. We're talking about the #1 reason why patients go see their doctor. People develop back pain, hip pain, leg pain, but they also can develop neck pain or shoulder pain. Another common condition that patients have is what's called stenosis, or narrowing of the nerves. There are ways in which we can try to help with that, either with therapy or injections to temporarily give them relief. But a real cure, a way to relieve that pressure, is a minimally invasive spine surgery to remove that disc that's causing pressure off the nerves. Where should patients go when they have spine problems? I think first and foremost they need to go to their family doctor. After that, if they still have the problems, they should go see a spine specialist. I really feel it's critical that the patient undergoes formal, conventional therapy and injections prior to undergoing any type of surgery. 9 times out of 10, we can get them feeling better without the need for surgery. One of the most minimally invasive spine surgeries that I perform is called an XLIF. The XLIF procedure actually only takes about an hour. That type of operation conventionally used to take 4 to 6 hours. This type of procedure has revolutionized spine surgery. People who couldn't play with their grandchildren are now able to do so. People who couldn't ride their motorcycles are now going cross-country riding their motorcycles. This is powerful for us, for me to see, and to confirm that minimally invasive spine surgery is vital to our practice of medicine.
Hi, I'm Katie Monsivais. I have a doctorate degree in biomedical engineering, and I've worked in the regenerative medicine and medical device industries for over a decade now. I'd like to welcome you to this video series, Regenerative Medicine Moments, in which I answer the most common questions about the realities of regenerative medicine in the United States today. Regenerative medicine is a healthcare approach in which doctors try to harness the power of the natural healing process to combat a wide variety of injuries and age-related conditions. The healing process is like a winding road that starts with injured tissue sending out signals to recruit additional healing materials. When we're young, those signals are loud, and the distances they have to travel are not very far. But as we age, some components of the healing process can change. Those signals may not be very loud anymore, and the distances they have to travel are farther than ever. And when they get there, there may not be enough healing materials available. In regenerative medicine, doctors don't try to replace the work of the healing process with plastic or metal. Instead, they try to directly address the shortfalls in the healing process. There are currently 2 approaches to this: indirect and direct. With indirect regenerative medicine, doctors try to amplify the signals that occur at the beginning of the healing process, hoping that a louder, stronger signal will recruit more healing materials to the site of injury. With direct regenerative medicine, doctors go to an area of the body with an abundance of healing materials. They collect those materials and then put them directly where they are needed. In either case, the physician is identifying the missing or deficient components and using the body's own materials to restore the power of the natural healing process.
The best way to have beautiful skin. Here to talk about the trend of prejuvenation are Megan Wilkinson and Danielle Howell. They're with Medical Aesthetics Regenerative Center. Good morning to both of you ladies. Thank you so much for being here today.
Good morning. Thank you for having us.
Okay, let's talk about this term prejuvenation. Kind of what does that mean?
So many people are familiar with preventative health care when it comes to medicine. Go to your doctor every year, get a physical, have your annual cancer screenings. So we're just taking that concept and applying it to aesthetics. If we do some things when we're younger, we can look better when we're older.
That's true. It kind of staves off the aging process a little bit.
Exactly.
You say it really does start with good skin care. How do you help your clients get on the right regimen for them?
So when we first see our clients, we talk about the importance, skincare starts with what we put in our body. So, people that have diets high in sugar, alcohol, dairy products tend to have more skin issues. So it really starts with eating healthy, drinking lots of water, good sleep at night, and good exercise. 3 treatment skincare options that we recommend to start at an early age in our 20s and 30s, which is when the first signs of aging start, include number 1, a retinol. It's very important to help stimulate collagen. The second one is an antioxidant, which helps counteract the environmental stressors that we have, smoke and pollution. And the third one is a good moisturizer, which is also very important to use on a daily basis.
And again, these are all things that anyone at any age can use. The younger you start, the better. But even if you're, if you're more mature, you can still incorporate these into your skincare, correct?
Most definitely.
Absolutely.
Okay.
Absolutely.
Let's talk about SPF. How important is it to wear SPF even in the winter months and make sure you have a good quality product?
So SPF is extremely important. We can't stress it enough. So the sun is the #1 cause of aging. So fine lines and wrinkles, sunspots, those brown spots that everybody talks about, and also collagen loss. So, and SPF comes in a wide variety of products. So we can do creams, tinted moisturizers, powders. It's just very, very important to use it on a daily basis, at least an SPF of 30 at the minimum.
Yes, and if people come in and see you too, you can help make sure they're using what's right for their skin type.
Absolutely. We have a variety of skin products for anybody here at Mark.
Okay, so let's talk about other things we can do for prejuvenation. You suggest smaller doses of Botox. Talk about how that helps ward off wrinkles.
Yeah, so neuromodulators, which are commonly known as Botox, what they do is they relax the muscles of facial expression. So when we raise our eyebrows or furrow our brow, we see those lines. Well, as we get older, if we don't treat them, those lines can set in and they can become what we call static lines, or we see them on our face all the time.
So even when your face is in repose, you can still see the deep lines.
Can see the deep lines. So if we start in our mid-20s to early 30s, by treating those, we can prevent those lines not only from being present at that age, but from getting set in and staying deep.
Right. Oh, that's a good idea. And again, it just takes a small amount because at that age you don't have a lot of wrinkles. Just a little bit, it'll
goes a long way.
Yeah, it's good. How can filler help keep your skin in good shape?
Yeah, so as we age, our face typically loses volume. So we'll see it in the cheeks or in our jawline, and that can create some sagging and some deep wrinkles. And that usually starts in our 30s. So if we use filler to replenish that volume, we can lessen those wrinkles, and it also has the added benefit of stimulating your own collagen for long-term results.
Which is what we want. And they do all of this at Mark right there in their office. I've been there. It's a lovely office. You all do such a wonderful job.
Thank you.
Thank you so much for being here today.
Thank you.
Hi, I'm Katie Monsivais. I have a doctorate degree in biomedical engineering, and I've worked in the regenerative medicine and medical device industries for over a decade now. I'd like to welcome you to this video series, Regenerative Medicine Moments, in which I answer the most common questions about the realities of regenerative medicine in the United States today. This is one of the most important questions you can ask about any medical procedure, but it's also a very broad question. It's it's kind of like asking if physical therapy works. The topic is so general that almost any answer is going to be incorrect for some patients. So I'd like to narrow this down to specific procedures for the most common regenerative technologies: platelet-rich plasma and bone marrow concentrate. Starting with platelet-rich plasma. Multiple high-quality medical studies have reported results after using PRP for the treatment of tennis elbow. In one study, PRP-treated patients had about 72% improvement in pain, while control patients only had about 56% improvement. According to experienced physicians, PRP is an effective treatment for lateral epicondylitis, which is tennis elbow. Multiple high-quality medical studies have reported results after using two specific kinds of PRP for knee arthritis. The type of PRP is important here because one kind, called leukocyte-rich, doesn't work as well. But the other kind of PRP, leukocyte-poor, or LP-PRP, has worked well. According to experienced physicians, LP-PRP is a safe treatment option for knee arthritis and has demonstrated its ability to reduce pain. Multiple high-quality medical studies have reported results after using cells from bone marrow to treat knee arthritis. Combined results from 5 separate studies showed patients treated with bone marrow cells had a significant decrease in pain scores 2 years after treatment. According to experienced physicians, bone marrow cells significantly decrease pain and increase function in knee arthritis. Multiple high-quality medical studies have reported results after using concentrated bone marrow to improve rotator cuff repair. In one study, 100% of BMC-treated patients had healed rotator cuff repairs within 6 months versus only 67% of patients who underwent regular surgery. 10 years after surgery, 87% of BMC-treated patients still had intact repairs versus only 44% of the regular surgery patients. According to experienced physicians, bone marrow concentrate provides significant improvement in rotator cuff repair surgery. So, is regenerative medicine effective? According to medical studies, it can be effective in specific procedures. A licensed physician who is trained in the practice of regenerative medicine can help you determine which, if any, regenerative therapies may be appropriate for you.
Nigos. I'm an ex-international Olympic athlete, threw for the University of Oregon discus and hammer. And Dr. Hunter operated on my spine some years ago, totally brought me back to life. I saw him a few months ago, explained that I'd been facing problems with my left knee and my right elbow. He suggested a stem cell injection with stem cells that come from my own body. We did the injection. I just did my follow-up now. 4 months later, I'm 100% back, pain-free, back in the gym, can go upstairs. Come see him. He is amazing. He will get your life back.
If you're starting off the new year with a new weight loss goal, our next guests are here to share their 4 keys to a successful journey.
Welcome this morning, Danielle, Howell, and Megan Wilkinson with Medical Aesthetics Regenerative Center. Good morning to both of you. Welcome to Charlotte today.
Yes.
Good morning. Thanks for having us.
Okay, we're talking about these 4 keys to losing weight. The first thing you want to talk about is to focus on fat loss, not weight loss. Explain.
Yeah, so when people are trying to lose weight, they can get very obsessed with a number on the scale, but you can be physically skinny and also unhealthy. So if we're going to bother to lose weight, we want to be healthy about it. So when we talk about body fat greater than 25% in men and 32% in women can actually increase our risk of having health problems. So when we're going to lose weight, we want to focus on decreasing that risk and becoming healthy overall. overall.
So we want to focus on that number, not so much the number on the scale.
Exactly.
That makes sense. Yeah.
Now, this seems like an oxymoron. You say to eat protein to lose fat.
So, you know, the goal of weight loss is to lose fat, but we want to maintain our muscle mass. So protein is what we need to do that. And inevitably, when people start a weight loss program, they intake less calories, which in turn means less protein. And most people aren't taking enough in to begin with. So it's just very, very important. And new studies show that we need twice the recommended amount of protein daily when we're on a weight loss program to help maintain muscle and help support our metabolism. So it's very, very important to eat protein to help support our body in fat loss.
Good, healthy protein. Okay, we can increase that. Next thing, you say to log your food and water intake. Know what is coming in.
This is my favorite tip because it's so easy and it can really shed some light on some maybe negative behaviors that we have. So a lot of people think they eat much less and drink much more than they really are.
Yes.
And so if you're writing everything down, whether it's on paper or using an app on your phone, then you can really see what you're putting in your body. And my favorite tip is write down why, because that can shed light on some boredom eating. Why are you eating that cookie? Is it because it's there or because you're actually hungry?
The handfuls of goldfish crackers that you're grabbing, you got to be honest, you got to put those in there too,
Exactly,
right? Okay.
exactly.
You also say come back, AKA accountability. I need some reinforcements. How does it work?
So, I mean, absolutely. You know, we are busy in our daily lives. So it's important you have ups and downs and setbacks and family stressors and jobs that get in the way. And so it's very important to stay accountable, and regular meetings with your provider help you to discuss the setbacks or the boundaries that you're having to success, as well as to reinforce the positive things. So it's just very, very important for accountability to help keep you on track to you can maintain your goal.
Makes a big difference for sure. Also, you want to remind people to move, exercise. It'll help you lose the pounds.
Yes, it will. Any good weight loss program includes movement. And everybody in January runs out and gets a gym membership, but it's important to recognize that you cannot out-exercise a bad diet.
That's right.
So that's why we've got to optimize your input, and then that exercise will actually pay off.
Well, tell us about the personalized weight loss program at Mark.
So here at Mark, we do an individualized body composition analysis and metabolic requirements, and we use those numbers to form a dietary weight loss plan that can include meal replacement shakes, bars, supplements. We have everything we need at Mark to help tailor and make an individualized treatment plan for each patient.
And your patients are seeing great success on this program.
Absolutely.
Yes.
Hi, I'm Katie Monsivais. I have a doctorate degree in biomedical engineering, and I've worked in the regenerative medicine and medical device industries for over a decade now. I'd like to welcome you to this video series, Regenerative Medicine Moments, in which I answer the most common questions about the realities of regenerative medicine in the United States today. The principles of regenerative medicine have been around for about 50 years or so, but they haven't really been mainstream until the last couple of decades. So the question is, how do doctors and researchers evaluate the safety of any new medical technology? First, they make sure that every device used in a regenerative medicine procedure is FDA compliant. Every single device used in a regenerative medicine procedure in this facility is FDA regulated and compliant. In fact, the device used for bone marrow has more safety features than almost any other device in its class. Doctors also consider the biological and medical benefits and risks of new procedures. The procedures done at this facility are autologous, which means they use only a patient's own blood or bone marrow. With autologous procedures, doctors are simply moving around something that was already in your body. They're just putting it somewhere it can be more useful. Unlike synthetic or laboratory-made products, Autologous materials do not expose patients to infectious material from a donor or laboratory environment. In this way, autologous products, or those using only a patient's own blood or bone marrow, minimize the risk of exposure to infectious material from external sources. Beyond the devices and materials used in a procedure, doctors also look at the history of the procedure as a whole in medical literature. This facility provides platelet-rich plasma, or PRP, and bone marrow concentrate therapies. Both PRP and bone marrow concentrate have been established as safe through hundreds of medical publications covering thousands upon thousands of patients in the medical literature. Platelet-rich plasma has been used in bone grafting procedures since the 1990s. It has also been used in orthopedic procedures for the last couple of decades. A few recent publications have had the following to say about the safety of PRP. PRP has no evident additional risk and can be widely used as a conservative treatment for knee osteoarthritis. In the arthroscopic repair of full-thickness rotator cuff injury, the injection of PRP is a safe and effective adjuvant treatment that can significantly improve early outcomes. Bone marrow concentrate has an even longer history of safety in orthopedic treatments. Here's what a few recent publications had to say about that. Implantation of bone marrow cells in rotator cuff sutures appears to be a safe and promising alternative to other biological approaches currently used to enhance tissue quality in affected tendons. Our study has shown that injection of MSCs in different osteoarthritis-affected joints is safe and therapeutically beneficial. I could keep listing these quotes for hours because there are so many studies that have found the use of bone marrow concentrate in orthopedic procedures to be safe. But I'll stop there because I think you get the idea. Well, we can't say that any medical procedure is 100% safe 100% of the time, just like we can't say that getting in a car is always safe or even playing baseball is always safe. There's some level of risk in every medical procedure, just like there are in our daily activities. But what we do know is that doctors and researchers have evaluated the benefits and risks of platelet-rich plasma and bone marrow concentrate procedures for 20 to 30 years now, and they've found that the benefits justify the risks enough that they classify these procedures as safe in their medical publications. Though there are other up-and-coming regenerative medicine technologies, none have been as thoroughly vetted as platelet-rich plasma and bone marrow concentrate. These newer regenerative medicine technologies have a very sparse publication record. For that reason, their safety is considered to be still under investigation.
There's a way to use your body to heal your body.
Welcome this morning, Dr. William Hunter with Medical Aesthetics Regenerative Center, along with his patient, Coach Ed Addy. Good morning to both of you. Welcome to Charlotte today.
Good morning. Thanks so much for having us.
Of course, Dr. Hunter, we're going to start with you. Tell us about stem cell therapy, what you're offering at your office now.
Well, I think it provides an opportunity, a unique opportunity, that we can take some of the stem cells, maybe even your own body, to heal an area that might be hurting you.
And why is it so important to take it from your own body?
Well, I think it's important from the standpoint of it is your own body. So there's not going to be any kind of infections. You're not going to have any reactions to it. It's going to be something that we can kind of take, and then those stem cells can maybe use the opportunity to be more of like a conductor in an orchestra to get the enzymes and proteins in the area to the healed area that needs to be healed overall with all the arthritis that people have or the sports injuries that they have.
Okay, Coach Ed, you are a local basketball coach. We want to let everyone know that. What kind of pain were you experiencing that brought you to Dr. Hunter? What was going on for you?
I was in extreme pain most of the time. I couldn't walk a flight of stairs. My knees were always swelling up on me. And because I coach basketball, I'm on my feet a lot. I'm standing up, I'm teaching, I'm coaching, and I'm walking across the basketball court, and Dr. Hunter sees me. They said, "Man, you look like you're in a lot of pain." So I'm explaining to him what was going on, and I was scheduled to get knee replacement surgery. And so Dr. Hunter says to me, "Hey, why don't you stop by the office? You know, I'd like to introduce you to a less invasive type procedure that I think will help you tremendously." But Eugene and I were talking off set, and he was saying the same thing. I would go upstairs and not want to come down. I mean, when I went upstairs, that was it for me, because I didn't want to have to make that trip upstairs again. That's how much pain I was in.
So you had the stem cell injections in both knees. What was that like? And tell us the results of that.
Oh, it was tremendous. I told Dr. Hunter I wanted to find him and hug him about 3 months later, because I felt like I could go out and run a marathon. So I went from barely being able to walk across the basketball court to being able to go out and play basketball with my players. You're like, when you're teaching and coaching basketball, you want to be hands-on. So it gave me an opportunity to get out there and move around with them and demonstrate to them what I was trying to tell them. Now I could get on the court and demonstrate it, and the pain was gone. I mean, I feel absolutely no pain at all.
It's remarkable, considering you thought you were going to need knee replacement surgery.
Yes.
You have avoided that, and now you feel great.
Absolutely tremendous. And I was going to need it. I met with an orthopedic surgeon, and they told me my knees were bone on bone. I had no cartilage left, and I needed to have my knee replacement surgery. And they didn't want to do it at my age. They thought I was a little bit young to do it, but they said because I played college football and college basketball, I did a lot of damage to my knees. And they said that was going to be the only way. That was the only option I had. Until Dr. Hunter tells me, "Hey, I've got an idea for you." And I'm like, "Okay, I'm all for it, man."
Well, Dr. Hunter, what other things can you treat with stem cell therapy? And I got this question, is it growing tissue? What is the stem cell actually doing?
Well, you know, I think the important thing to understand is that I don't think it's necessarily growing any tissue, but I think it's going to act more like a conductor in an orchestra, where it's going to go ahead and say, "Hey, let's get these enzymes, healing enzymes over here, let's get these other proteins over here," and it causes this good inflammation to all of a sudden help the healing process. But we're talking about, you know, anybody with arthritis, maybe in their knees or hips, in their spine. As a neurosurgeon, I treat, you know, brain and spine disease, and so anybody with degenerative disc disease, or people that might have some tendonitis in their ankles or elbows or something like that, any kind of sports injuries, this is very, very helpful.
I mean, really, people can just give your office a call and find out if this is right for them. If they're experiencing pain of any kind, call and come in and get a consultation, right?
Absolutely. And I think, you know, because, you know, I am a neurosurgeon, you know, we're talking about high bar being set. We're going to make sure MRIs are done, things get evaluated appropriately, and at that point in time, we'll determine whether or not a stem cell candidate could, you know, be an option for that patient, like it was for Coach Addy.
I'm sure you were very grateful to him. Right?
I told him if he did any chores done, car wash, paint the house, whatever he needs me to do.
If you're interested in learning more, call Mark.
Hi, I'm Katie Monsivais. I have a doctorate degree in biomedical engineering, and I've worked in the regenerative medicine and medical device industries for over a decade now. I'd like to welcome you to this video series, Regenerative Medicine Moments, in which I answer the most common questions about the realities of regenerative medicine in the United States today. There are lots of ways to look at the differences between regenerative medicine therapies, so we'll start with the simplest way first. The easiest way to understand the differences between regenerative medicine therapies is by looking at their source. Do they come from the patient being treated, or do they come from somewhere else? Therapies that come from the patient being treated are called autologous. These are the most frequently used regenerative medicine procedures right now, and they have the longest, best track record in the medical literature. Therapies that come from a person other than the patient are called allogenic or allogeneic. Because these therapies come from a different person, they must go through stringent processing and testing to ensure they are safe. Some products like this may claim to contain live cells or even live stem cells. Independent testing has shown this claim to be misleading at best. What's really interesting is it doesn't really matter if these products have live cells in them. Well, your immune system is designed to recognize and attack foreign material. That's why organ transplant recipients have to take immune-suppressing drugs. They have to prevent their immune system from doing its job. But in people like you or me who aren't taking immune-suppressing drugs, if someone else's cells are put into our body, they will be recognized as foreign by our immune system and they will be attacked and killed. So even if allogenic products do have live cells in them, at best, those cells are going to cause inflammation and irritation before surrendering to death at the hands of your immune system. In my opinion, that's probably one of the reasons we see so few publications with allogenic products. They just can't get past the immune system, so they never have a chance to work. Yes, there are different types of autologous therapies. This facility offers platelet-rich plasma, or PRP, and bone marrow concentrate therapies. Platelet-rich plasma uses the patient's own blood to form a fluid full of cells and materials that encourage healing. The cells are part of the patient's immune system, and the healing materials are platelets and proteins that are part of the normal healing process. Platelet-rich plasma is kind of like fertilizer in a garden. It provides materials that speed up the growth process. This facility offers bone marrow concentrate as well. This technology uses a patient's own bone marrow to form a fluid full of cells and healing materials. Sounds familiar, right? Well, bone marrow concentrate is a bit like PRP, but with some key differences in the form of adult stem cells. Bone marrow concentrate contains mesenchymal stem cells, hematopoietic stem cells, and endothelial progenitor cells. The most important of these three are the mesenchymal stem cells, or MSCs. MSCs are the body's natural resource for repairing and rebuilding cartilage, bone, and every type of connective tissue. Bone marrow concentrate has been successfully used in orthopedic procedures for over 30 years now, and it has the longest track record of safety and efficacy of any regenerative therapy in the medical literature. PRP comes in second in that category. There is a grain of truth to that idea, but it's 90% misconception. It is true that the number of mesenchymal stem cells in our bone marrow declines over time, but it's a slow decline. In fact, one of the world's leading orthopedists and researchers in regenerative medicine routinely treats patients over the age of 70 years with their own bone marrow concentrate. And he finds that these procedures are generally better tolerated than total joint replacement, with less side effects, shorter hospital stays, and faster recovery. Another thing to keep in mind about mesenchymal stem cells is that they're prepped by their environment. Bone marrow-derived mesenchymal stem cells are poised and ready to repair bone and cartilage. Adipose-derived mesenchymal stem cells are poised and ready to become fat cells. That's right. Fat is a form of connective tissue, and it is one of the forms of tissue that mesenchymal stem cells can become. Adipose-derived mesenchymal stem cells can repair other types of tissue than fat, like cartilage or bone, but they require additional signals and time in order to do what bone marrow-derived mesenchymal stem cells would do automatically. The last thing to know about fat-derived mesenchymal stem cells is that they require extensive processing. And sometimes that processing includes an enzyme whose job is to chew up connective tissue. So if these cells aren't extensively and thoroughly washed before they go back into a joint, they may bring with them a substance that actually damages joint tissue and speeds up the degenerative process. The icing on top of that cake is that one prominent researcher has shown that adding adipose-derived mesenchymal stem cells to the treatment of osteoarthritic knees doesn't add any benefit. So you have all of the extra processing, all of the extra risk with these cells, and no benefit. I just don't see any good reason to use these cells, but I do see reasons to avoid fat-derived MSCs, at least when it comes to orthopedic conditions. A lot of people have heard misinformation about regenerative therapies, especially when it comes to stem cells. There seems to be this very common misconception that embryonic stem cells are better than adult stem cells, but that's not really true. Yes, theoretically, embryonic stem cells can become any type of cell in the human body. But let's think about that for a moment. Where and when do embryonic stem cells know how to behave and how to become every type of cell in the human body? Only in the context of a pregnancy in a uterus. Outside of that environment, embryonic stem cells just don't have the signals and cues they need to do anything like what we would want them to do. And medical literature has shown us repeatedly that when we try to take them outside of that environment and put them into the adult human body, they do far more harm than good. Compare that to mesenchymal stem cells, whose natural home is in the adult human body, whose natural job is to repair cartilage, bone, and connective tissue in the adult human body. Mesenchymal stem cells know what to do in your body. That's why we have more than 30 years of published medical literature showing them to be safe and effective in orthopedic applications. So embryonic stem cells may be something that scientists research in a lab, but they don't provide any benefits for patients in the here and now. In my opinion, the best regenerative therapy is the least invasive option that provides the benefits the patient needs. In many cases, that's PRP. In many other cases, that is bone marrow concentrate. In almost every case I've ever seen in this field, the best choice, as determined by a licensed, trained physician, has been an autologous regenerative therapy. Hi, I'm Katie Monsivais. I have a doctorate degree in biomedical engineering, and I've worked in the regenerative medicine and medical device industries for over a decade now. I'd like to welcome you to this video series, Regenerative Medicine Moments, in which I answer the most common questions about the realities of regenerative medicine in the United States today. This is a totally understandable question that I get all the time, and honestly, it causes me a lot of frustration because the simple answer is most regenerative medicine procedures are not covered by insurance. There are a couple of procedures in which a small part of it may be covered by insurance, but by and large, most regenerative medicine procedures are not covered by insurance. I hear this a lot, and I think it's because we have a very common misconception in this country that insurance coverage means that a procedure works, but that's not really true. Let's take steroid injections, for instance. A lot of insurance policies cover steroid injections for osteoarthritis, but a recent medical study looking at a bunch of different published studies on corticosteroids said that they found little evidence either way to say that corticosteroids worked or that they didn't work, and that in the cases where it seemed like it did work, the benefits disappeared within 6 months. Add to that the fact that recent studies have started to indicate that steroids may actually increase damage in joints and potentially speed up the process of arthritic breakdown. But steroids are covered by a lot of insurance policies. Another great example is Lasik surgery. Almost everyone I know knows someone who has had Lasik and loves living their lives now without the hassle of keeping up with glasses or contacts all the time. Lasik works. And yet, according to experts, insurance coverage for Lasik procedures is rare if it exists at all. Some insurance companies have even gone so far as to classify Lasik as a cosmetic procedure. Now, I could speculate about the reasons that some medical procedures and devices have insurance coverage while others do not, but I think that's a waste of time in light of the facts. We know that insurance coverage doesn't necessarily mean that a procedure is effective, and a lack of insurance coverage doesn't necessarily mean that a procedure is ineffective. We also know that doctors are trained to recognize which procedures are appropriate for each individual patient. So in my book, if a doctor tells me that a particular procedure is appropriate for me, I'm at least inclined to entertain the idea that the doctor knows more than the accountants and actuaries at the insurance company. The good news is that your doctor has a variety of payment options available, and regenerative medicine procedures aren't nearly as expensive as the media may have led you to believe. If you're interested in a regenerative medicine procedure, please speak to your doctor or their office staff. There are options and plans available for every patient in every financial circumstance. I honestly think they might wake up tomorrow and say, yes, we're covering all regenerative medicine procedures because insurance providers stand to save billions of dollars per year by covering regenerative medicine procedures. And some healthcare cooperatives have actually started covering regenerative medicine procedures for that exact reason. Regenerative medicine procedures are not covered by most insurance companies, but the same is true for other effective medical treatments. Some healthcare cooperatives and self-insured companies have started covering regenerative medicine procedures, and I expect others to follow suit in the future.
Regenerative medicine is a cutting-edge field of medical treatment that uses the body's own natural healing ability. The Spine Clinic at Neuroscience and Spine Center of the Carolinas are offering regenerative medicine and stem cell therapy as an alternative to surgery. Dr. William Hunter, a board-certified neurosurgeon, is here to tell us more. So, doctor, what are the advantages of regenerative medicine and stem cell therapy over conventional methods?
It's clear that the maximum amount of stem cells come from each and every one of us in our own bone marrow. So I take the stem cells from the patient and in a matter of a few minutes implant the highest stem cell concentration into the affected area. We are able to harvest the maximum amount of stem cells from your body and then help direct it to the areas that are degenerating. Help to heal those degenerative regions is exciting to see because it works. Harnessing the power of the body's own healing processes and directing them to the weaker area. Patients feel better, their joints heal, they're able to get back to the things they want to do.
And what kind of problems can be treated with stem cell therapy?
The parts of the body using stem cell treatments for my patients have been knees, shoulders, hips, and also the spine. The degeneration or the tearing of these joints, ligaments, and tissues may be healed with the use of stem cell therapy and able to delay or even avoid the need for surgical intervention. The stem cell treatment is performed in an office setting. It only takes minutes to obtain the stem cells and harvest the stem cells to implant them. Then the patients will feel improvement in a few weeks and typically last for years.
Thank you, Dr. Hunter. To learn more, visit neurosciencecarolinas.com.
If you suffer from arthritis or a nagging sports injury, there's a way to use your body to heal your body.
Colleen went to Medical Aesthetics Regenerative Center to find out more.
Stem cell therapy here at Mark is changing lives. We're joined now by Dr. William Hunter. And first off, explain what stem cell therapy is.
Well, Colleen, thanks so much for coming. We're excited to actually have this opportunity here in North Carolina to actually do stem cell treatments. Basically, the stem cell is part of your own body being able to help support and heal another part of an injured area. So for instance, if you've got a bad knee because of a sports injury or arthritis, we can go ahead and actually use the stem cells to activate that area to allow that area to heal up.
And where are you getting these stem cells? From the patient's own body?
From the patient's own body. And I think that's where the power comes from. We're able to go ahead and obtain the cells, get them activated, and then what it can do is that those stem cells, when they go into someone's knee, for instance, it's going to act as a conductor. It's going to go ahead and allow all the other enzymes and proteins and interleukins and cytokines to get into that area, help with good inflammation to allow that area to heal up.
So who is a good candidate for this? I mean, is this for anyone who has arthritis, maybe has, you mentioned the knees, a shoulder, things like that? What areas can you treat?
Yeah, I think that's a great question. Oftentimes what we're finding now is basically all the people with sports injuries or arthritic changes. People that have bad knees, bad hips, bad shoulders. I'm even doing spine where there's some problems in the lower back. Oftentimes as a neurosurgeon, I'm seeing patients, and performing operations. But there's some patients, most patients don't even need an operation, but they still have pain. If there's a way that we can kind of help with their degeneration, they might have degenerative disc disease or some kind of ankle injury or a Achilles problem. All these things can get treated with the stem cell treatment.
What is the downtime from a procedure like this?
Well, that's the benefit. It's basically, it can be done here in the office, typically about an hour's time. You're back at home, and then really we want you to kind of take it slow and easy for about a week or two, and then slowly, gradually work your way up to things, and then you'll start noticing some changes after a couple of weeks to months and years on down the line.
So if someone wants to know if this can help them, they come in here, they get a consultation, they'll meet with you and find out if this is right for them.
Absolutely, that's how we'd like to do it. Bring their MRIs, let's sit and chat, see if there's a way to keep them away from an operation. Maybe they don't need spine surgery, maybe they don't need a knee operation, maybe they don't need a shoulder operation. Maybe there are ways at which we can do minimally invasive stuff using stem cells to try to help treat the problem.
And that's a game changer because I know people would like to avoid surgery, certainly if they can. What is the reaction you're getting from your patients who have stem cell therapy?
Oh, the patients are just doing fantastic. I mean, we're really excited on how well these patients are doing after this type of procedure. They're able to get back into just living their normal life again that they were having problems with months before.
Well, you've got to call Dr. Hunter, schedule that consultation, come here to Mark, find out if you're a good candidate for stem cell therapy. You're doing great work, Doctor.
Well, thank you so much for coming. Excited that you're here.